Hi, Dr. Tom Lewis with RealHealth Innovations, reporting on a health assessment tool we refer to as your chronic disease temperature. Your chronic disease temperature is a new way to measure your health. Specifically, it's a measure of how much chronic disease you have in your body today. We all remember when Mom took our temperature and she wanted to make sure that we were at 98.6 and not above. That temperature is a measure of your core body temperature. It tells you how well you feel right now only, really. This new temperature RealHealth has invented is your risk for, or your temperature for, chronic disease. It's a simple, single number that quickly allows you, your health coach, and your doctor understand your risk for chronic disease. In addition, your chronic disease temperature tells you and your health team the magnitude of your existing chronic disease, assuming you already are sick. The value and usefulness of your chronic disease temperature is it gives everyone who's working to make you well a target for your good health, and that target is 98.6. You see, we've designed your chronic disease temperature scale to exactly match the scale for your regular or core temperature that Mom used to take. So we all understand that 98.6 is normal. For your chronic disease temperature, when it's 98.6, it means you're either free from chronic disease or have very low risk of chronic disease in the future. On the other hand, if your chronic disease temperature is, say, 103 degrees, then either you're already suffering from a chronic condition or are at very high risk of becoming sick, and soon. Your chronic disease temperature value is based on a series of tests called biomarker tests. These biomarkers used in your chronic disease temperature are quite sensitive to changes in your body. Scientifically, we call those changes in your physiology. A single biomarker may go up or down with changes in your lifestyle, for example, like the lack of sleep or stress. Therefore, we use many biomarkers when we calculate your chronic disease temperature. So minor life events won't raise your number at all. However, these tests are highly sensitive to changes associated with serious chronic diseases like cancer, heart disease, diabetes, arthritis, and all the diseases of inflammation. The names of these, by the way, all end in itis. Chronic or continuously low levels of inflammation in our body is now being associated with chronic disease. But modern medicine is slow to react to this and seldom tests for low-level inflammation. RealHealth to the rescue, because our chronic disease temperature is specifically designed to diagnose the earliest and slightest signs of chronic inflammation. When we find inflammation in you early, we very often can quickly and easily stop the inflammation at its source and return you to good health, or better yet, prevent that chronic condition from occurring in the first place. That is the power of your chronic disease temperature.